Dr. Ruiz from California for his questions.
Thank you. Let me just take a step back as a public health expert, an emergency physician. The request to have vulnerable, immunocompromised workers have accommodation because they are at high risk from dying from COVID, and we want to make sure that they live through COVID, seems reasonable to me. Yeah. In fact, it's pretty good public health practice. The other request of keeping an open mind and not have a one-size-fits-all, because we know how much that this virus changes. It could drastically change in its properties, and therefore we should be able to respond to new variants as they come. Also, seems reasonable. Seems pretty scientific in the sense that, you know, you don't want to have a one-size-fits-all, because as we're realizing, these variants eventually may lead to a steady state, but they may also not. And then the third accusation here about wanting some kind of guidance to open or close is the same thing that the economists were asking, and all the other organizations in our society were just, that didn't understand all these different nuances. They just wanted some basic, help us understand when to open, when to close, help us understand this. That was asked by so many in so many different sectors, not just for schools. But at the end of the day, the CDC didn't even accept that one. The CDC didn't even put triggers into opening or closing. So what are we doing here? So we all agree that the pandemic took an enormous toll on our nation's kids. Learning loss and the mental health crisis facing America's youth are serious issues caused by multiple dimensions of the pandemic, like a parent dying from COVID and the suspension of in-person learning done to slow the spread of a deadly novel virus, especially in high-risk communities. And as a father and a physician, I have a profound appreciation for the magnitude of these challenges and the importance of working together to address them through forward-looking policy solutions. Instead of discussing policies that can help our students overcome learning loss or bring relief to the millions of kids and teens struggling with their mental health, we are here to examine partisan allegations by House Republicans seeking to vilify our nation's dedicated educators. These uncredible allegations will do nothing to prepare us for the next deadly airborne pandemic and keep our schools safely open while reducing its transmission. Ms. Weingarten, the American Federation of Teachers represents 1.7 million teachers, nurses, and staff members who keep our nation's schools running. What steps have you and your members taken to accelerate learning and support students' mental health, which is what we need to be focusing on following the pandemic?
So thank you, Dr. Ruiz. We have done many things over the course of the last 3 years to do that, and I'd be happy to give you many of them. But my most recent speech in March 2028 talked about two things that we have to do. Number one, we have to meet the social and emotional needs of children. Children are really suffering right now and have been for a very long time, but it has been escalated because of the pandemic. So what we thought was, if we do things like we've done at Wolf Academy in Baltimore, where we wrap services around schools, and as a result, this academy is now the second highest performing school in Baltimore. If we do more of those kind of community schools with wrapping services around, my understanding is that one of your witnesses in the last hearing talked about all of those things. We can actually accelerate learning by meeting the needs of kids. And the second thing is, we have to bring joy back to schooling. And things like experiential learning. I start as a high school social studies teacher in a career tech school, Clara Barton High School in Brooklyn, New York. What we now know is that 94% of kids in career tech ed graduate from high school, 70% go to college. What's the difference? It's hands-on, it's robotics, it's debate, it's all the things that we need to do in this new economy. Let's do more of that kind of experiential learning and do
Thank
things
you.
like
Although I
that.
know the chairman's going to give me the same allotted time that he has, I just want to be more efficient in the
Sorry.
questions. While we sit here today under the false pretense of needing to protect kids from teachers' unions, House Republicans are trying to pull the wool over the American people's eyes. Look, as we speak, Speaker McCarthy is holding America's full faith and credit hostage so that he can jam through a budget with draconian cuts to programs that kids in each of our districts rely on for mental health and academic success. For example, House Republicans' extreme budget cuts would slash funding for the 988 Suicide Lifeline, leaving nearly 1 million people facing a suicide or mental health crisis unable to access support and stabilization services. House Republicans propose this cut at a time when suicide is the second leading cause of death among kids ages 10 to 14 and the third leading cause of death among adolescents ages 15 to 24. Ms. Weingarten, how would cutting funds for resources like the 988 Suicide Lifeline hamstring efforts to address the mental health crisis facing America's youth?
Look, we need these resources. We need kids feel so anonymous right now, and they focus too much on their devices. We need places for kids to be able to talk, and
So
these
removing
suicide
that-
lines are very helpful for kids.
Yeah, in fact, it'll make it worse. It'll take the help away, and it'll hurt our kids. House Republicans are also proposing a 22% cut to the Health Center program, which would cut off services to roughly 2 million of our nation's most vulnerable patients and families, especially those who receive services through school-based health centers. For kids with less access to care, school-based health centers are a critical lifeline to primary care services, tooth and eye exams, mental and behavioral health counseling, and so much more. So, Ms. Weingarten, how does gutting funding for community health centers, including school-based health centers, undermine children's health and educational outcomes?
Look, I very much appreciate, Dr. Ruiz, that I was asked to speak today and talk about what kids need and talk about it in the context of what happened in COVID and going forward. All of what you said, we need these services for kids. Schools are centers of communities for our kids and our families. So we need these services connected to schools.
Well, you know, I totally agree, but while House Republicans continue to push an extreme agenda through hyperpartisan investigations, we will guarantee Democrats will continue to put people over politics and develop meaningful solutions to the challenges facing America's kids. They need our help now with policies that will help improve their mental health and their academic success. Thank you. I yield back.
Thank you, Dr. Ruiz. As chair, I do have to comment. I'm a physician also. And there were no partisan questions that I was asking you. I was asking you about process. That's what this hearing is about. This committee is to address some of the many things that Dr. Ruiz was talking about. That's not what today was about. That's fine, if that's what you want to spend your time, and maybe the whole dais on that side is going to talk about policy, politics, and things that we may debate. I didn't disagree with the guidelines that you recommended, as you inferred. That was not the case. I didn't disagree with them. I just asked about the process. These were guidelines you recommended. These were guidelines that were accepted. I'm just trying to go through the process so that we have a good process, so that your voice is heard in the proper way, and that we are using science and that the process is very clear from the beginning. So the next time, we can do a good job. So you can continue the policy debates, which we will have. But that's not what today's hearing was about.
Dr.
And so you
Winstrup,
will see from our side, we're going to ask about the process.
I'm just trying to answer,
And
just like you want me to answer the questions you've asked.
I don't mind you answering his
questions
questions.
Dr. Ruiz asked.
I don't mind you answering his questions. And he's right. I'll give him the time that I took. And that's fair. And that's what I'm trying to do, conduct a fair hearing. But this is about the process we are trying to understand, because school closures had such a tremendous effect on our children. And so can we move forward someday and have a process that is very efficient and that we can do it better? Because let's face it, both sides of the aisle, a lot of mistakes were made along the way.
I don't know if you've seen this book yet, Dr.
I now recognize Chairman Gomer of the full